Good morning, everyone. We'll begin today's briefing with Mayor John Cooper and Dr. Alex Jehanger, Chair of Nashville's Coronavirus Task Force and Chair of the Metropolitan Board of Health. We will also hear from Dr. James Hildreth, President and CEO of Meharry Medical College, and Lisa Quigley, Chief of Staff for U.S. Congressman Jim Cooper's office, and Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department. Here this morning to help answer your questions will be Dr. Gil Wright, Interim Director of Health for the Metro Public Health Department. We'll now begin with Mayor John Cooper.
Good morning, Nashville. I want to start today's briefing by thanking everybody for their well wishes. Laura and I have both tested negative and completed the CDC recommended quarantine period. Now, what could have been a stressful time for anyone was made easier with your support. Now, testing is important. Early COVID detection allows for better health outcomes. Hospitals have new therapeutics like monoclonal antibody treatment, and that can prevent serious illness if COVID is diagnosed and treated early. Testing can make a difference and save lives while we wait for more vaccine to arrive. Now, Chief William Swan is here this morning to review our cold weather testing plan that will make sure our assessment centers stay open during these cold winter months. Now, today I'd like to provide a vaccine update, followed by today's COVID-19 metrics and an update on our recovery efforts for 2nd Avenue, and a brief update of the latest federal stimulus package. As most of you have heard, vaccine distribution is taking longer than expected across the country. Here are the facts. Until now, the federal government has released only half the doses of all manufactured vaccine. Now, of the vaccine that is available, Tennessee expects and has received 80,000 doses a week. Now, 40% of the state's allotment has been sent directly to nursing homes and long-term care facilities. Approximately 48,000 doses are being split across 95 county health departments per week, and Nashville is only receiving 5,300 doses a week. Now, based on state and CDC guidance, these 5,300 doses are going to those 75 and older, outpatient healthcare workers, and Nashvillians with intellectual and developmental disabilities who cannot live independently. Now, to date, all providers across Nashville have administered 54,304 total doses of the vaccine, which includes 5,000 second doses. Now, of that total, our hospital partners have administered 47,000 doses to eligible Davidson County workers or residents. Metro Public Health has administered 7,328 doses. Now, we expect to get another approximately 6,000 doses into arms within the next week. Now, in Nashville, our health system partners can vaccinate thousands more residents every single day, but we need more vaccine. We are limited by the amount of vaccine that we have received. We are also constrained by immunization rules that aren't prioritizing some of our most vulnerable residents, such as transplant patients, the immunocompromised, and others with very high-risk health conditions. Now, we are advocating for changes in those regulations to include these vulnerable people as more vaccines are released to local health departments. Our goals as a city are not to waste a single dose, to use every dose as soon as it comes in, to keep wait times low, and to follow the phased approach prescribed by the state and the CDC. Last week, Metro Public Health began phase 1A2 of Nashville's vaccine strategy, so that last Saturday and Sunday, 1,120 eligible Nashville seniors received their first dose of the vaccine. Now, residents reported efficient operations and minimal wait times. Through efficient planning, every dose that was prepared for the weekend clinic was used. Not a single dose went to waste. Seniors will continue to receive vaccinations by appointment every weekend throughout January. Additional appointments will become available to those on the 75 and over waiting list when we receive more vaccine. To be added to the waiting list, visit covid19.nashville.gov, and you can also call 615-862-7777 between 7 a.m. and 7 p.m. Once you register, your name will remain on the waiting list until you receive your vaccine. Vaccinations for other Phase 1A2 recipients started on Monday, and Public Health is also working closely with our hospital systems as they begin vaccinating their established senior patients. These include Vanderbilt, HCA TriStar, Ascension, St. Thomas, Nashville General, and the VA health system. To increase the rate of vaccinations throughout our community, Public Health is working with Meharry Medical College to begin a 75 and over clinic this weekend. Now, I'm so pleased to see him back. Dr. James Hildreth of Meharry is here today to discuss this highly contagious COVID variant that we've been reading about in the newspapers, and also why choosing to get vaccinated is more important than ever. Now, COVID is still spreading at an alarming rate in Nashville. New cases per 100,000 residents is 99 and matches the record highs we saw during our post-Thanksgiving spike in cases. Our 7-day positivity rate is 17.8%. This is also well above our 2020 record highs. But it is lower than our surrounding counties that are reporting positivity rates of 23 and 24%. There are currently 572 active COVID hospitalizations in Nashville, but 2/3 of these patients are still coming from outside of Davidson County. Every COVID death in Nashville is a tragedy, and Nashville has been spared the higher mortality rates seen in counties without mask mandates. Yesterday, the top 5 worst performing counties had an average death rate of nearly 2% of total cases, and Davidson County's mortality rate remains at less than half of that, below 1%. These numbers align with Vanderbilt's report that mask mandates lead to substantially lower death rates due to COVID. Masks and social distancing have saved lives in Nashville, and we have to continue to do that in the months ahead. We cannot relax our guard just because the vaccine is here. Healthy habits will take pressure off our hospitals and frontline workers, giving the vaccine time to do its job. Now, last weekend, our Nashville Strong Moving Days gave affected families another opportunity to safely recover their belongings from the bombed-out area. In another sign of progress, 2nd Avenue between Broadway and Commerce has been reopened to business and to foot traffic. A preliminary inspection suggests that all the damaged buildings on 2nd Avenue can be rehabilitated, but we have to preserve the historic character of 2nd Avenue while fulfilling a shared vision that improves this neighborhood for everybody. Now, this will require an inclusive process with businesses and residents to build back this iconic part of historic downtown Nashville, even better than it was before. Now, as an important reminder, Catholic Charities has received a $2 million federal grant to help bombing victims. If you lived and worked in the affected area, you can apply for these funds online at NashvilleStrong2021.org. Now, some qualifying households have now received a second stimulus payment from the federal government. For others, promised payment is coming. A new round of unemployment benefits and small business loans, including PPP loans, is also available. Now, thanks to the Save Our Stages campaign, nationally, $15 billion from the federal government has been included in the stimulus bill for venue operators. And Nashville is the home to over 40 live performance venues that could each qualify for this program, with an initial grant of up to $10 million, as well as a supplemental grant. Priority will be given to venues that face the biggest revenue losses in 2020, and these venues were some of the first to have to close during the pandemic. That's why I'm grateful to everyone who's worked so hard to secure this critical funding for our stages that is so important to Nashville. And I know it's been a priority of our own Congressman Jim Cooper. And representing Jim's office today is his Chief of Staff, Lisa Quigley, who is joining us by video to discuss this second stimulus package. And today, I'm also pleased to introduce our hero of the week, Ms. Perry Mcdonald, an MNPS food box distribution volunteer at Haywood Elementary. A Vanderbilt graduate, Perry has had a career as an attorney, a public school teacher, and is involved in many community organizations, including the League of Women Voters. I'm grateful for her service and her generous spirit. And now I'll turn it over to Dr. Alex Jehanger, Chair of the Metro Coronavirus Task Force.
Good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 6,790 active cases. On Monday, we had 8,531 active cases, which is the most number of active cases we ever had in the city. Our total number of cases has now reached 77,795 and 394 since yesterday. Our rolling 14-day average is now 669 cases per day, which is up from 594 last week. Our 7-day case positivity rate is 17.8%, which has dropped from 21% just last week. In Davidson County, over 861,000 tests have been conducted in our residents, and our transmission rate now is 1.01. In Middle Tennessee hospitals, there are 943 individuals admitted with COVID, down slightly from a little over 1,000 last week, and 572 in Nashville hospitals specifically. 524 Nashvillians have died because of this virus. Now, Davidson County is currently in phase 1A2, as well as those 75 years and older. So far, more than 25,000 Nashville residents have been vaccinated, which is nearly 3% of our county's population. Last week, Metro Public Health began vaccinating Davidson County residents over the age of 75. And just last weekend, 1,120 were vaccinated, with plans of vaccinating an additional 1,200 this weekend. Now, you have to have an appointment to get this dose, and all the time slots for this weekend are filled. But as the mayor noted, the wait list is open, and we'd ask that you please sign up for this. And you can go to our website, covid19.nashville.gov, to sign up, or call 615-862-7777. These appointments and the wait list are for those over 75. Our mission is to get every Nashvillian vaccinated as quickly as possible. And we're doing this both with public health and with our partners in the health systems. The limiting factor of getting everyone vaccinated is getting the vaccine. The federal government allocates vaccine to the state, and then the state allocates these to local hospitals, local health department, and other entities that are vaccinating. As soon as we get the vaccine, we are getting it out into the appropriate arms as outlined per the state's phased rollout plan. Now, an update on our community assessment centers. Beginning next week, the hours will become 10 a.m. to 3 p.m. With the colder weather, we must ensure that our staff and patients stay safe. And with more consistent hours that are later, we hope that we'll have to have less interruptions to the schedule, although daily weather will dictate our schedule. Now, I'm very encouraged to see the vaccine is here getting in arms. I was actually there when our seniors were getting vaccinated this weekend, and many have not been out since the pandemic began. And it was so exciting to see these individuals get vaccinated and to see how happy they were. However, as encouraging as this is, we must stay vigilant. Our numbers are really not where they need to be, so don't let your guard down. Do everything we've been doing for the past 10 months. Keep your distance, wear your mask, stay at home when possible. And if you get any concern that you've been exposed, please get tested. With that, I would like to turn it over to Dr. Hildreth. Thank you.
Good morning, Nashville. With respect to the COVID-19 pandemic, we are now in a period that William Shakespeare might describe as defeated joy. Yesterday, hundreds of thousands of Americans were inoculated with a safe and effective COVID-19 vaccine. On that same day, however, more than 200,000 new cases were diagnosed and more than 4,000 people died. Physicians who treat hospitalized COVID-19 patients have developed such effective protocols that now the chances of dying from COVID-19 are much less than they were before. At the same time, there are more people now hospitalized for COVID-19 than we've ever seen before. And now when most of us are acknowledging and doing the things that we need to do to keep the virus in check, we find out that there are variants of the virus in multiple countries that might be more transmissible than the virus we've been dealing with. I'd like to say a few words about that. RNA viruses, like the COVID-19 virus, they mutate their genes as part of a strategy to evade our immune systems. In order for new viruses to be made, genomes have to be copied over and over again, such that hundreds of thousands to millions of copies of the genome accumulate. In this copying process, mistakes are made that can change the genes. And when this happens, the proteins themselves can change. Proteins are strings of amino acids that are strung together in a very specific sequence. These strings of proteins of amino acids can then fold on themselves to make specific shapes. And antibodies that bind to protein can bind to short sequences of amino acids, or they can bind to shapes. It turns out then that viruses can avoid antibodies by mutating their genes to change the sequence of proteins or the shapes of proteins. Now, in the case of COVID-19, the spike protein is the protein responsible for getting the virus inside of the cells. The spike protein assumes a very specific shape right before the virus goes into the cells, and that's the only time it gets made, which means the immune system has a limited opportunity to see that particular shape. Moderna and Pfizer did a very clever thing in designing their vaccines. They modified the spike protein so that it's permanently locked in to the shape that's needed to get into the cells, which means that the immune system has a much better chance of seeing that shape and responding to it. So the prediction was that these vaccines should induce antibodies that neutralize multiple strains of COVID-19. And it turns out that that's exactly the case. We now have data to show that the vaccines from Moderna and Pfizer do in fact elicit antibodies that neutralize the variants. That's very good news. Even better news is that all the things that we've been doing to mitigate the spread of the original strains, they work perfectly well against the variants because they represent mechanical and chemical restraints for the virus. What that means, Nashville, is that if these viruses are more transmissible, we need to be focused more than ever on doing the things that we've been doing the last several months. Washing our hands, keeping our distance, avoiding crowds is really important. And also then the masking then, I have to emphasize that over and over again. We must wear the mask. Let me say something about the vaccine rollout. We're trying to do something in this country, indeed around the world, that's never been done before. Here in the United States, we're trying to vaccinate 330 million people in a very short time. The scale of the logistics of this are such that glitches and hiccups were bound to happen, as they have happened, and more are probably going to happen. But we need a measure of grace and patience because people at all levels are doing the best that they can. And let me just say, as I said before, what was really needed was a nationally coordinated strategy to manage the logistics. Local and state health departments were not prepared to do this. That was well known and understood. That is why a national strategy was needed. In the meantime, hope is on the way. Vaccines are coming, but it's going to be a few months before we all get vaccinated. So let's continue to do our part to keep the virus in check. So Nashville, as we always have, we've got this. Let's do our part. Thank you.
Thank you, Chief. Up next is Lisa Quigley. Lisa?
Thank you so much. And thank you to the mayor for inviting me. And I'm so pleased that you and Laura have both tested negative. Thanks for inviting me. I'm taking Jim's place today. He is on his way back to Nashville. We are not using planes due to COVID, and so he's somewhere between Roanoke and Bristol, but he sends his regards. Before getting into some of the details about the second stimulus and now what may be a third stimulus, I just think it's appropriate to acknowledge the events of last week. The insurrection at the Capitol was a really traumatic moment for our country. And as Nashville's representative in Congress, Jim voted to impeach the president yesterday in a bipartisan vote for the president's role in this domestic terrorism event. There are now more troops in the capital city guarding the Capitol complex and the National Mall than in Iraq, Afghanistan, and Syria combined. We got a briefing by the FBI yesterday. There have been dozens of arrests. 170 case files have been started, and the FBI indicates that those numbers will increase exponentially in the coming days and weeks as social media images aid their efforts. Thanks to the public for that. Jim also wanted me to acknowledge that our Black and Brown communities are feeling particularly vulnerable right now, especially as warnings persist about armed unrest at our state capitals starting this weekend, including our state capital in Nashville. If those of you are looking to the inauguration next week, we were reassured yesterday that the 9 months of planning in this event will be successful. This is an event that is aided by not only the Secret Service, the Department of Defense, the FBI, and the DC Police, as well as the Capitol Police. So we're feeling very confident about that event. The new administration will likely bring new COVID relief, aid to families with robust vaccination plans. President-elect Biden is announcing his relief bill this morning. It should be another $2 trillion in relief, including a proposal for another $2,000 in stimulus checks and more unemployment insurance. There'll be a mass vaccination plan and close coordination and resources with state and local authorities. Now that $2 trillion is on top of the first relief bill of $2.2 trillion and the second relief bill of $900 billion. So over $300 trillion so far, with hopefully another $2 trillion to be approved by the Congress when the new Congress is aligned with the new presidency that begins next week. In terms of amounts to Nashville so far, nearly $500 million has been delivered to Metro government, but much more so to individuals, families, and businesses for about a total of $5.2 billion. But that's actually before the second relief bill because we don't have the new numbers yet for funds that have just gone out for stimulus and unemployment benefits. The second bill had money for vaccines and PPE, unemployment insurance for 11 weeks through March 14th, stimulus checks. We're super proud of our Save Our Stages initiative that also was a part of this plan, and the mayor mentioned that earlier. MMPS has received millions of dollars. The eviction notice was extended until January 31st, and there's been additional PPP for business. What to expect in the new administration that might be different from what we had on the first or the second, or particularly the second stimulus bill, is there's going to be a focus on state and local resources. We're hopeful that we'll be able to get more support for our restaurants, which are so critical to Nashville, and further extension of the eviction notification. For Jim's focus with this new administration, it's what you would expect. It's getting the economy back. It is getting a handle on this disease and having a successful vaccination process. Assistance for Nashville due to the bombing, which we already have some of the money that's been released and approved through FEMA, but there may need to be more. And I know that this city is working closely with the state and also with FEMA to figure out the next steps. And finally, we are going to be requesting, and did request earlier this week to the president-elect, that there be a reversal of the Medicaid waiver that has been approved between the Trump administration and the Lee administration in the last days of this administration, which is a terrible proposal that will only limit and reduce the amount of healthcare support that we have for our poorest citizens in our state. The final thought is that it is an optimistic time whenever we have a new administration. And I just want to acknowledge that we are going to have our first female vice president, who will also be the first Black president and the first Indian American president in that position. And she certainly exemplifies, I think, a symbol of hope as we move forward into this new era. So thank you again for inviting me to speak today, and I'm available for questions at the end, should there be any.
Thank you, Lisa. Up next is Director Chief William Swan.
So good morning, Nashville. The health and safety of all of our Nashvillians is the top priority on our top priority list. During the coming days of cold weather, we have to ensure the safety and health of our healthcare workers as well as our citizens. Because of that, we are taking steps to adjust the Community Assessment Center hours. As Dr. Alex Jehanger had noted earlier, starting next week, they will be from 10 to 3 p.m. We monitor the temperature closely in partnership with the National Weather Service. We do an hour-by-hour analysis. We have made 35 degrees in air temperature or wind chill the deciding factor to when to not or when to open the assessment centers. So sometimes you may notice a delay until that temperature hits the threshold of 35 degrees. But as the mayor stated earlier, such importance of testing. On days when the weather is too cold to open all three assessment centers safely, we will close the Kmart site and the Meharry site. However, we will open the Nissan Stadium site so that you will still have access to testing on these days. Please keep in mind, we still will pay close attention to the weather and the temperature. We hope that everyone will have patience. We're so thankful to partner with Meharry. If you think about, for over 40 weeks, they have been out doing these tests. Over 300,000 tests that they performed. So we ask that in our partnership with Meharry, that you have patience and understanding that they're out every day, Monday through Friday, braving the cold weather and also the inclement weather to provide the service to Davidson County. And also keep in mind that it's not just Davidson County that we test. We also touch our bordering neighbors as well. So thank you, and we just ask for your patience.
Thank you, Chief. We'll start today's questions starting with Kathleen Seary at Channel 17. Go ahead, Kathleen.
Good morning. Thanks so much for taking our questions. This is for Mayor Cooper, and it's not related to COVID-19, but the Beacon Center has recently expressed concern about corporate tax credits and the state being on the hook for around $800 million in credits to companies, obviously during this time of economic turmoil because of COVID-19. So I was wondering if Mayor Cooper could comment on the situation in Nashville and answer if companies have expressed a willingness to work with the city and state given the current economic situation. Thank you.
Kathleen, and thank you to Fox 17. I don't know the specifics about your question. I will say, to answer sort of the B part of your question, companies have in Nashville shown great willingness and understanding of the current environment and working constructively to get us on to the next side. In terms of the state's use of tax credits, that's just at a whole level that's different and greater than any city. And again, that's going to be between a watchdog group, the Beacon Center, and the state to help monitor where that is. Thank you.
Our next question comes from Julia Palazzo from Channel 2. Good morning, Julia.
Hi, Brian. Thank you. A few questions. Just to follow up to Chief Swan, have you seen a drop-off of volunteers at the community assessment centers because of the cold weather? I know that you guys have really leaned on them to direct traffic and help out with some other protocols there on the testing sites. And then two non-COVID related questions for the mayor. Mayor Cooper, at least one local business, the bookshop, said this morning that they're going to be closed through an inauguration day due to the ongoing concerns and potential threats to the Capitol. Have you been in discussion with local law enforcement and the state about security and preparation at the Capitol ahead of the inauguration? And second, I wanted to ask you about pedestrian fatalities in Nashville. Last year being a record number of pedestrian deaths. I know you committed to Vision Zero about a year ago, but just in the first few days of this year, we've already had 3 pedestrian fatalities. Many people concerned, many advocates still concerned about this problem. What is the latest on combating this issue as far as funding the improvements, and will this become a top priority in 2021? Thank you.
Thank you, Julia. We'll start with the Chief.
Thank you, Julie, for your questions. Your question was referring to the volunteers. Well, I want to just really hats off to Hands on Nashville, along with our state guard, partnership with Meharry. And no, we have not noticed a fall off as far as our volunteers. I would welcome anyone just to take a moment to realize for 40 weeks, Meharry has been out there in the heat, also in the cold weather. But when we talk about being a strong partnership with the city, that's what they do. And all the volunteers from Hands on Nashville and our state guards, again, we thank you and appreciate all the work that they're doing.
Well, and thank you, Julia, for those questions. Lawful, peaceful protest is part of American life, but if that line is crossed, we are ready. I have been in conversations with law enforcement, and I think you know, they're ready, and they've been working the problem in cooperation with a whole lot of federal activity on this problem. Last week was an incredibly sad week for America, the product of lies, mob, and hate, and it shows what can happen, but the answer to the question, we are ready for that here. As to your question about Vision Zero, we're completely committed to it. It's part of the reason I'm grateful to the council passing the transportation plan a couple of weeks ago so that we can begin to line up funding to make our streets safe. It sounds like it shouldn't be a problem, but clearly we have unsafe streets in Nashville, and we're going to need money and get on that problem. It's unacceptable. The safety here compared by other cities and other streets, we have unsafe streets here. And again, I'm grateful to the council for helping us get on that problem so that we can line up the funding to solve it.
All right, our next question is Brett Kelman at the Tennessean. Good morning, Brett.
Good morning, everyone. I have 2 coronavirus questions. First, at the beginning of this press conference, Mayor Cooper mentioned the launch of a Meharry clinic for people 75 and older. I just wanted to verify if that is the by appointment vaccinations that are already occurring, or if that was a separate new announcement, in which case I would like some details. Secondly, because we are discussing what sounds like a very limiting supply of vaccine, I was curious if the mayor or Dr. Jehanger or Dr. Hildreth could respond to the reported Biden plan of releasing the second half of vaccine currently held by the federal government. As it stands, for every vaccination dose that is distributed, there is supposed to be a second dose held by the feds for later use as a second dose, and I believe the Biden transition team has publicly mused that they intend to turn that reserve into additional immediate supply. I would love to hear what people think about that.
Thanks, Brett. I think we'll have Dr. Wright answer your first question about the Meharry Clinic.
Thank you, Brett. This is an additional clinic that we're working in conjunction with Meharry with. We're also working with them to help with some of our wait list so that we can get through our 75 plus population quicker. So it's an ongoing and developing situation where we want to get as many vaccines in arms as quickly as we can, and we're looking to our community partners to help us with this. And so we will be moving forward with this, and as chance comes, other opportunities. I believe Dr. Hilder's going to answer second.
There are many experts, including myself, who believe that releasing all of the vaccines all at once, without having assurance that the second dose can be administered in a timely fashion, is a very bad idea. It's a bad idea because it abandons the science that underpins what we know about these two vaccines. And I need to stress that there are decades of research leading up to the development of these vaccines. So to abandon the science, knowing that the science has been done at such a high level, is a mistake. Now, if there are plans to ramp up production of vaccines to make sure that the second dose will be available in a timely manner, then I'm all for releasing all the vaccines. But there needs to be a plan at the same time to make sure that everyone gets their second dose. And while I'm here, let me just say this to those who are going to get the vaccine. You all need to know that the first injection will cause fairly mild to no reactions whatsoever. But please understand that when you get the second injection, when you induce a secondary immune response, you can expect the reactions to be much more, not severe, but more apparent. You might get swelling under your arm from the lymph nodes. Lymph nodes swelling, it means the immune system is working. You may get fever. You may feel drowsy, fatigued. That's not unexpected. So please know that the second injection is likely to give you more problems than the first, but it's all expected. It just means your immune system is doing what we expect it to do.
All right, our next question comes from Tosin Fakili at Channel 4. Tosin, good morning.
Good morning, everyone. I had a couple questions for the mayor and one for Dr. Hildreth. For the mayor, I was wondering, since we're talking about increasing the pace of vaccination, any word on just how much more and how much sooner of the vaccine doses that Nashville is going to get? And just any concerns about just swiftly trying to get through this and making sure everyone is vaccinated in a timely but proper manner. And also for the mayor, since on the national level, there's a lot of money going for venues, any word yet on just how quickly Nashville will see some of that money? And for Dr. Hildreth, I was just wondering, and you may have just touched on it a little bit, do you think there needs to be a ramp up of production of the vaccines from both companies to help meet the pace? I know you said we need to be patient, but do you think there needs to be the production of vaccines needs to be quicker so we can get more people vaccinated? Thank you.
Thank you, Tosin. I think we'll start with the mayor.
Well, thank you, Tosin. Let me ask Dr. Jehanger or Dr. Wright to comment on the path of vaccinations. I think it's important for everybody, as we do that, to be well informed that this is a long process. And you're talking about weeks and weeks and weeks before you're getting the vaccine into places such as schools to allow for a rebound and reopening. But again, on the specifics of that, let me defer to Dr. Jehanger. But while I'm still talking on the venues question, I don't know specifically, but I will say once the federal government has been appropriating in this area, money has been showing up relatively quickly. So I do urge all the venues to be in touch with my office and with Jim Cooper's office to make sure that that application is in, because the Treasury is writing checks pretty quickly on this matter, and I know the money is desperately needed. Thanks.
In regards to vaccine, the state has told us that right now we're expected to get about the same amount for the near future. Definitely, we have plans in place if they ramp that up and can get more vaccine in arms as we receive it. And we want to use it up as quickly as we can once we receive it. But right now, the state has told us that we will just be receiving this 5,300 doses for all of Davidson County for at least for the next several weeks or longer. And that leads to the question, I think, for Dr. Hildreth.
The Moderna and Pfizer have been asked to do all they can to ramp up the production of vaccines. But keep in mind that there are raw materials that are needed to make these vaccines, and that's going to be a limiting factor. So I know they're making them as fast as they can, and I'm really happy that so many people, the fact that demand is outstripping supply to me is a very good sign that we'll get enough people vaccinated to achieve herd immunity. But it's going to be impossible to make the vaccines much faster than we're currently doing it, just because of some limitations of the sites needed to make the vaccines. But also keep in mind, 2 more vaccines are likely to be online in the next couple of few months. AstraZeneca's vaccine and Johnson & Johnson's. In the case of Johnson & Johnson, theirs is a single-shot vaccine. And both of those vaccines will not have the logistical challenges in terms of storage that these two do, the first 2 do. So that's why I'm saying a little bit of patience is in order, because much more vaccine is on the way, both from Moderna and Pfizer, but also 2 other vaccines, possibly, if they get approved.
And I would like to make one additional amendment or addition to what Dr. Wright said. As far as Metro Public Health Department, when we get allocated our dosage of vaccines each week, and they come out weekly, we have a plan to get that week's dose into people that week or within the week. So that's the commitment that we've made. We'll continue to do. So as fast as we get, we as a Metro Public Health Department get vaccines, within that week we will have it in arms. And that may mean taking people off our wait list, which is a huge priority for us, working with other organizations in the right phase, so 1A2, when we go to 1B with schools. Our goal will be to get vaccine out to people ASAP. So just be aware of that, and we will keep you apprised as to how we keep doing that. Try to on a weekly basis. Thank you.
I believe that's all the questions we have today. I'd like to thank Lisa Quigley for joining us. And the next COVID briefing will air on Thursday, January 21st at 9:30 a.m. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.